Hello and welcome. I am Pranav Kulkarni and I am joined by Dr. K. Sridhar, Director, Institute of Brain and Spine Neurosurgery, Kauvery Hospital. Dr. Sridhar, it's a pleasure to have you with us on Republic TV.
Thank you very much. Thank you for having me with you.
Wonderful, sir. Dr. Sridhar, there's an open source data which we've accessed from the current cancer registries, which shows that there has been an apparent global incidence of malignant brain tumor, which stands at about 4.25 cases per 1 lakh person years. And there's been a steady rise in brain tumor cases becoming more common each year. In fact, the numbers that we have show that 50,000 new brain tumor cases are diagnosed every year in India itself. I just want to ask you, sir, what exactly are brain tumors? Could you tell us what exactly is a brain tumor?
So basically, a brain tumor is an extra growth in the brain.
Right, sir.
It's basically what it is. And it can arise from either tissues inside the brain or from tissues which cover the brain. Okay. So these are different types of brain tumors which can happen. So basically, it's an extra growth which can happen. And these brain tumors are all, we call them tumors which are inside the skull. So these tumors can be either malignant tumors, which are cancerous tumors, or non-malignant tumors, which are non-cancerous tumors.
And how does a tumor affect an individual?
So a tumor affects an individual either by hampering the function of the area from which it is arising, or it can give rise to things like epilepsy and fits because of hyperfunction or irritation of the nerves around that area. So if a patient has a tumor near the area of speech, you can have a problem with speech. If it has affection of the vision, then you can have a decrease in vision, a decrease in hearing. It can even be a weakness of one side of the body. Okay. So it can even be a problem with mentation and cognition. So depending on where the tumor is, the patient can get affected by symptoms.
Okay. But what are some of the symptoms, some early signs that show that an individual may have a tumor, sir?
So the most common symptom is persistent headache. Now, persistent headache is something which very often patients come to us with, and we find that they have a tumor. The other common symptom is fits, especially which start after a patient becomes an adult. Fits are common in children without any apparent reason, but when they start in an adult without any history of previous fits, that can be a sign that the patient has a tumor. But very frankly, any disturbance of the brain or the nerves related to the brain, which are new, that will be the first sign. And what happens, unfortunately, is that very often these very early signs are disregarded, and patients often say, let's wait and see if we get better. And therefore, the diagnosis gets delayed. Yeah, so that's a very interesting and important question, because generally some people get scared with a simple headache and they say, is it a brain tumor?
Right.
So a simple headache, something related to, say, acidity, like you said, or hunger, you would know because it recurs every time you are hungry and you get acidity, you get the headache. So you would know that.
Right.
A vascular headache or a migraine headache, like you called it, is also very specific. It is one-sided. It is related to some sort of activity or some sort of food. And that can be diagnosed also by looking at the symptomatology and why the patient gets the headache. But more importantly, I think the question is, when should a patient see a specialist for the headache?
Right.
I think if a headache is persistent, does not go away with simple medication,
right,
or there is a change in character of the headache, then the person should see a specialist and get it investigated further.
Okay. And what are some of what is an early detection in this case? Should there be an early detection? Does an early detection help in this case?
Yes, of course. So in these patients, when the patients come in early to us with these symptoms, the best way of detection is by an MRI scan. And
Okay.
nowadays in India, we have some of the best technology which is available.
Right.
So an MRI scan will detect a brain tumor very early in the course of the tumor. When a brain tumor is detected early, you can then treat it early,
Right.
and therefore that has the best chance of cure.
Okay.
So early detection is always good.
Okay. But my question then to you is, are all tumors that are there in human brain, are they all cancerous?
No, like I said, the tumors can be either cancerous or malignant tumors, as we call it, or they can be non-cancerous or benign tumors. So they are completely two different types of tumors.
Okay.
So they are cancerous tumors and non-cancerous tumors. So it is completely different, and the prognosis, management, everything changes depending on what is the type of tumor the patient has.
Okay. Dr. Sridhar, my very curious question is, what could be some of the causes? I mean, what could be the reasons that an individual is developing tumors in the brain, sir?
A very small percentage have a familial or a genetic predisposition. A very small percentage.
Okay.
Majority are what are called sporadic, which means it just comes. Now, why does a person get a tumor and not the other person? That's a lot of speculation. There are a lot of theories.
Okay.
But the most prevalent theory nowadays is that there is a genetic mistake in the DNA, which would lead to the patient developing a tumor.
Okay.
And that gene has to be triggered by another gene, which, if stimulated, will trigger the first gene. So it is a problem with the genetic makeup of the person, which leads to even a sporadic tumor. But these sporadic tumors are not familial, so they do not go from one generation to the other.
So you necessarily mean to say that it's beyond human control to probably...
As of now.
Okay. To avoid... Okay.
As of now.
Okay.
Because we still don't understand the exact cause.
Okay.
This is, like I said, the prevalent theory. If we know more, now we are able to map the human genome.
Right.
So we are able to do genomic studies on patients and try and understand which are the particular types of genes which are affected in particular types of tumors. But we still haven't got the entire information for us to take preventive action.
Okay. Is age any factor in any way in tumors, sir?
No, unfortunately not. You see, the range of tumors which can happen in the brain it's a huge range.
Right.
There are different types of tumors.
Right.
Some tumors are seen more in infancy and childhood. Some tumors are seen in the middle age, between the 30s and the 50s. And there are other tumors which are seen later on in life. So you can get a tumor at any point of time in your life. The tumor may differ in its pathology, but it will be a tumor.
Okay. So you said it is related to genes. It is related to human. It probably goes back to birth. Why in that case has there been an uptick in the number of tumors in the country? So why has there been an increase in the number of brain tumor cases in the country if it was all just related to pure,
I don't think that there has been an increase in the number of tumors. I just think that with better technology, increasing better infrastructure as far as imaging of the brain is concerned, and more accessibility to good health care, that we are seeing more tumors being diagnosed.
Okay, so there's more discovery of them, or
yes, I think basically there is more discovery. I don't think there is. I mean, there are more tumors developing, but I think we are looking at them because we see what we know. And currently, we are able to see so much with modern technology that we are able to discover even small tumors. And therefore, the numbers of tumors that we are seeing are definitely much more.
Okay. Sir, I want to take you through this, okay, headache, discovery. What are some of the treatment options available in front of patients today?
There is one simple rule. I mean, let's not go into gray zones. One simple rule for brain tumors. The best chance of a cure for a brain tumor is by surgical removal of the tumor. That's the best chance, and that is what should be done in about 95% of all tumors that are seen in the brain. The remaining 5%, there are a few other options, but majority would require some sort of a surgical procedure to get the pathological diagnosis.
Okay.
So at the end of the day, that is also a type of surgery, but you're not going to remove the tumor, you only get a biopsy. So end of the day, if you see a diagnosis of a brain tumor,
right,
needs a surgical procedure. Most of the time to remove the tumor or to get a biopsy. Because without pathological diagnosis, you don't know what the tumor is. And currently, we just don't look at a slide. It's all molecular pathology. So we can know very clearly what is the type of tumor, what type of tissue it is coming from, what is the growth rate of the tumor, and there are a lot of specific treatment methodologies for specific tumors.
Okay.
And therefore, I think that would be necessary before we go ahead.
Okay. If I have to ask you about the specifics of the surgical procedure, what does the procedure look like, sir?
Okay. I mean, there is a lot of misconception about brain surgery.
True.
Some patients even ask me whether we unscrew the top of the head to remove. No, it is true. That's unfortunately the level of information that has gone down to public, and perhaps we are at fault for not giving that information or raising the level of awareness. But what we do now is that, again, technology has come so that the way we do surgery now is completely different from the way we used to do surgery maybe 20 years ago.
Right.
We now have very precise localization of where the tumor is. So I know exactly where the tumor is in the brain, in the head. And with a machine, something like a GPS, we use a navigation so we know exactly there. And therefore, we don't have to make a big opening in the skull.
Okay.
So one thing is, the question asked is, do we have to open the skull?
Yes,
we have to open the skull because the brain is encased in a very thick bone. So however we do it, we have to open the skull somewhere. Okay. But the opening is not very big. So most often, it's a smaller sized opening directly related to where the tumor is. The second is we use equipment, most often called the operating microscope. Now, this is a big machine with a lot of technology built into it, where it gives us not only good light, it helps us magnify the tissues to about 10 to 15 times. It gives us filters of different types so that we can distinguish normal from abnormal. So what happens, and we use instruments which are less than 1 millimeter in dia at the tip. So it is sub-millimeter instruments. Therefore, the surgery now is extremely precise. So we go straight down to the tumor without cutting much normal brain, and we remove only the tumor. We don't pull or push or remove normal brain.
Okay.
When we do that, we now also have the technology to monitor the functioning of the brain. And we are able to map and track the nerves around the tumor in the brain itself. So we know we are not disturbing the normal brain tracts or normal brain nerves or tissues and things like that. So what has happened is surgery has become precise, surgery has become safe, and therefore we are able to do more, but with less risk to the patient.
Okay.
So patient safety, patient outcomes have become much, much better. And once we finish the surgery, we close all the layers. So we close the covering of the brain, we put the bone back, we close the scalp. And most often this is done behind the hairline of the patient, so that once the hair grows, sometimes you don't even know whether the person has had a brain surgery or
Or
not.
not. Okay.
So that is how actually a brain surgery takes place.
That's a complex,
It
almost
is
like
complex,
space
but
science.
it is all technology driven.
Right.
And because it is technology driven, it is precise and much more safe than you would think it is.
Okay. But what's the recovery period like, sir? After a brain surgery is done, what is the recovery period like?
So generally speaking, if a patient has a brain surgery today, unless it's an extremely complicated surgery, let's not go to that. But on an average, the person with having a brain surgery would be awake within a few hours of the brain surgery, of the finishing of the brain surgery. The next day morning, the patient would be sitting up, having some liquids, then breakfast maybe. We normally mobilize the patient. That means get the patient out of bed. We make them walk to the toilet, things like that. So that is the recovery, so that in a couple of days, the patients can go home. So that's the sort of recovery of the patient post a brain surgery.
Okay.
So no more is the thing that the patient with a brain surgery is in bed for a week, 10 days, things like that. So it is out of bed fast and to the ward where rehabilitation or whatever is needed is done, and the patients go home as soon as possible.
Okay. And can we say that brain tumor is completely curable? I mean, by this, what I mean is, let's say there was a tumor in, let's say, someone's vision area. Does the vision also get repaired? Does it completely get recovered?
Now, you've asked two questions.
Okay.
One is it curable?
Correct.
One is complete recovery of a function which has got affected.
Absolutely, sir.
Okay, so I'll take one at a time.
Right, sir.
If a brain tumor is diagnosed early and it is not a highly cancerous tumor, there is a good chance at cure.
Okay.
Tumors which are malignant or highly cancerous, we still do not have a cure for them. They will come back, generally in the brain only, because brain tumors which are malignant don't spread to other parts of the brain,
Right.
unlike cancers of other parts of the brain which can come to the brain.
Correct.
But malignant brain tumors don't go to the other parts of the body.
Right.
So if there are malignant brain tumors, we still do not have the knowledge to cure them. What we do is maximally remove the tumor and then give them radiation or chemotherapy, which helps in delaying the tumor from coming back.
From spreading. Okay.
But the tumor will come back sometime. We don't know when.
Okay.
It may be 9 months, it may be 2 years, it may be 5 years, it may be 10 years. So, but it will come back. So we need to keep a serial watch and follow up of the patient so that we don't miss a tumor coming back. But a tumor which is not malignant,
Okay.
which has been removed completely, there is a very good chance of cure.
And the function returning.
Yes.
As well.
No.
Okay.
Function returning is the second question. So there is very good chance at cure. And even with certain malignant tumors, when we diagnose them very early, and when they're confined to a certain place and they're not gone deep inside, we can cure them in a certain number. So cure is possible, but dependent on early diagnosis. Now, I'll come to your second question, which is, can function which is gone come back?
Right.
You must remember that the brain and nerves are perhaps the most delicate structures in the human body. If you take a flower and squeeze the flower, squeeze it just for a second and then let it go, the flower doesn't get damaged, isn't it?
Right.
But if you squeeze it for about 5 minutes and then let it go, the flower gets damaged.
Right.
Similarly with the brain. So if a patient has lost function of the eye, suppose vision in one eye has gone and it's just about a week, 10 days, there is high chance that the patient's vision will come back.
Okay.
But if the patient has lost vision for 6 months or a year, and then we do surgery, then we don't know. It is chance. Because the nerve has got compressed for so long. And therefore, it is highly likely that the nerve structure and function would have been, at least part of it would have been permanently damaged.
Okay.
And therefore, we cannot promise or say that the function will come back. And therefore, again, early diagnosis is the key.
True.
Delay in going to see a specialist if there is a problem will always lead to problems.
True. Very true. But sir, detection of cancer, my final question in fact would be that detection of cancer or being told that your loved one has brain tumor is a shocking, revelation to the family itself.
It is.
What's your advice to the families that are probably already facing this or patients who are probably already facing this? What is that one word of caution or solace that you would want to give?
It is not caution. I would think when you deal with a brain tumor, especially a malignant or a probably cancerous brain tumor, it is like fighting a war. You have to do your best, give it all to win the war. Because otherwise, you can't do anything. The other option is not do anything, which is giving up right at the very beginning. Because there are tumors, there are brain tumors which may look malignant, which may look cancerous, where the patient can, like I told you, survive for 5 years, 6 years, 8 years. If you ask any good neurosurgeon who has got enough experience, will tell you we all have patients like that. So we cannot say which patient will not survive for a prolonged period of time. Yes, there are indicators, but nothing written in stone. So I think what we have to tell our patients is, we have to do the best for the patient. Yeah. And that is what we would all want to do for our own loved ones.
True.
And then it depends on the biology of the tumor, which we can't change. But at least we must try. Because if we don't have hope, there is nothing, isn't it?
Absolutely.
If we don't have hope, there is nothing. Yeah. And I think that is something which, as doctors, we must be able to convey to our patients. We must give them a sense of positivity, not nihilism. Mm-hmm. And I think that works a lot in helping families cope with this out-of-the-blue disastrous news, probable brain tumor, cancerous brain tumor. We actually have even a support group which we have created, where patients help other patients. Patients who have gone through the whole thing help other patients. Their families talk to each other. We don't interfere so much. Because the everyday life of a patient and a patient's family is something which they experience. And as doctors, we really don't have much insight into that. And one patient's family can help another patient's family. And we find that helps a lot as well in getting patients and their families to bounce back, to be positive, to try and win the war.
True. So as you rightly said, Dr. Sridhar, it's hope, and what people like us have is actually the doctors like you and technology and early detection, as you've rightly pointed out in case of brain tumor. Dr. Sridhar, thank you very much for joining us on Republic TV. It was a pleasure having you with us. Thank you.
Thank you.